Although she first noticed symptoms in November of 1997, Mary was not diagnosed with ALS until May of 1998. When we first met her in October of that year, she used a wheelchair most of the time but could still use a walker with assistance. Here is her first interview.
Mary.
Mary, okay. Mary, and how old are you?
Do I have to do it?
Yes, you do. It's important.
59.
59 years old. Okay, Mary. Mary, you've been diagnosed as having ALS, is that right?
Yes.
Okay. Could you tell me when you were diagnosed with that?
It'll be a year in November.
A year in November. What were your first symptoms, Mary?
No, maybe not that. I wasn't diagnosed really until...
But you first noticed the symptoms last November, and this is now October of the next year. Okay, so a little bit less than a year. What were your first symptoms that you noticed?
I couldn't run. My toes didn't work.
Your toes didn't work, okay. And then shortly thereafter you were diagnosed as ALS?
I'm not sure. Is that really sure? Do you know it's like June? It was nearly June.
Nearly
before
June.
They committed themselves.
Okay, well, let me ask you, what kind of shape were you in June? Were you on a cane? Could you walk without a cane, or what kind of shape
I
were you?
could not walk without a cane.
You had to walk with a cane by June, okay? And now this is October, and I see we have a walker here because you're now having to use a walker, okay? Okay, what is the prognosis? What did the doctor tell you about your future?
He didn't say. He wouldn't say.
Did the doctor have anything he could do for it that would stop its progression or reverse its progression?
There is one medication,
Mm-hmm.
and I don't even know if I remember the name.
Okay. Did you consider taking that medication?
I do take it.
Has it helped? It hasn't helped, huh? Okay, fine.
I'm still...
You're still taking it though, right? Well, that's okay.
Right.
That's okay. Now, let me ask you, can you, would you put your hands out? Put your hands out. Would you squeeze your fingers together? Just kind of do this. Okay, but you're still able to do that. That's good. Do you have full control in your hands still? Yeah, you got pretty good control.
I don't have very much strength. in my
Okay.
hands at all.
Now, as far as your legs, can you pick your leg up like so?
Yes.
Okay, but can you wiggle your ankle?
No,
Can you wiggle either ankle?
I don't think.
But the ankle will not pick up, will it? You have a dropped foot and your foot doesn't pick up. Okay, fine. And you're not able to get up on your walker by yourself at this time, is that correct?
Yes.
That's correct, okay, fine. So in other words, you have to have assistance to get on your walker, but once you get on your walker, you're able to walk, right?
Well, there's instances that I'm able to just get up and get my walker.
Mm-hmm. But most of the time, do you need assistance to get on your walker?
I always feel better if
Yeah,
somebody...
I understand. Okay, well, we're going to start treating you today, and we're going to be talking to you again later, and let's see what happens here, okay? Thank you so much. About a month and a half ago?
Yes.
Okay. And since then, Tom, your husband, has been treating you?
Yes.
Okay, and you've been using the Hansi puncture technique with the Hansi. You're also doing with the O and the V, along with the injectable Z. Okay. Can you, in your own words, first tell me what's different now?
I'm able to get up by myself,
Okay.
and I park my chair and walk,
You can walk now without the walker?
but I'm touching the walls.
Well, that's okay, but you're not using the walker anymore.
No,
That's fantastic. Okay. What about your appetite? How's that?
I'm pretty chubby.
You're pretty chubby, huh? You're pretty chubby, so you got your appetite back to normal, in other words, right?
Yes.
Okay. Anything else that you can tell me about that seems to be working a little better for you? Okay. Hey, I'm going to go over to Tom for a second. Tom, you have an objective view of this. You're watching every day. What can you tell me?
Okay, you know, first thing is the drop fingers started working in 48 hours, but the real thing that was really impressive by the third week, when you put somebody in the car that doesn't use their lower extremities, they park both feet on the quarter panel, which
Right.
is where the door closes. And in 3 weeks, she could, even though she's still using the car, she'd get out, sit in the car, pick up both feet, turn them around, sit them on the floor mat. Now that's outstanding.
Did she know she was doing that?
No.
No, she didn't.
I didn't think so. Most people don't realize because it's something they've done their whole life. When they start doing it again, they don't even notice it.
She can buckle the seatbelt most of the time by herself, but it doesn't make any difference. Most people can't buckle the seatbelt every time.
Right, right. Well, let me ask you something about that.
There's one other thing that's really important. In other words, I cook and wash and do all the other stuff, but in the last 3 weeks or 4 weeks, the pots and pans or the plastic bowls that we do not put in the dishwasher,
Mhm.
she washes them at the sink as she was doing about 2 months or a month prior to using Hansi.
Isn't that
She had
something?
just about quit doing that because
Mhm.
she couldn't stand up by the sink by herself,
Mhm.
but now she can.
Well, let me ask
Now
you,
she does, let me rephrase it.
if we had a hand strength of 0 being no hand strength and 10 being as strong as she's ever been, I know, what was her hand strength before Hansi?
I would say it was about half,
A 1/2 of 1. What do you think her hand strength is now?
3.5.
That's very good, okay. What else have you noticed about her? Anything else?
Well, let's see.
How about mental attitude, chipperness?
All right, all of her family and everybody noticed that her voice has come back. In
Mhm.
other words, when she has full use of her voice,
Strength again.
strength, voice strength.
Mhm.
Her,
Actually, her voice is deeper now. I found her voice seems to me to be a little deeper than it was before. A little stronger feeling.
stronger.
Yeah, stronger. That's what I'm saying. It's stronger.
Yeah.
It's got some
It
strength
was
in it.
getting weak, yeah.
Yes.
I mean, there's no doubt in my mind about
Yeah,
that.
I noticed that today when she walked in.
I think that, you can tell that she was, I've been able to tell on not on a daily basis, because with the slide down with ALS, she was on a slide. She's turned around, stepped to the other side, and now she's on a ladder that has rungs, and she's climbing the ladder back up.
That's great.
But the whole thing is that progression is almost on a day-to-day basis better, and being really objective, you can see it going uphill, but
Mhm.
the only thing you can do with a slide downhill is try to plan where the slide was going to get steeper.
Exactly.
And since I don't have to worry about sliding anymore, I can notice the things going back uphill.
That's
at a better
fantastic.
rate.
That's good.
Uh,
Okay, well, Mary, let me ask you to do something for me. Cross your legs. Now, how about the other one? Yeah, and you couldn't do that before, could you?
No.
No.
You couldn't do it without using your hands, could you? Oh, I know. I'd seen you before. You'd always use your hands to move your legs.
Yeah,
Well, that's pretty neat.
Hold your legs straight out.
Yeah. Now, that's absolutely incredible.
See that?
I mean, she could not move those legs like that before.
When we were in St. Augustine, there's no way she could have done that.
No way she could have done that. No, the first day we met you over in St. Augustine. No, she could not do that. Good. Okay, Mary, for the biggie. You just stand up. Incredible. That's incredible that she's standing up.
It's for you. You want me to walk?
Yes, come on. I want to see you walk.
Across the room.
What we're doing is just recording your progress, mainly for you. Okay, that's good. That's good, thank you. Okay, we have Mary Shepherd with us again today. And Mary, what is today's date?
August 10th.
1999, right? And we first saw you, I think, in October of 98. Okay. And you came in here with your daughter, Sutton, and you had your walker with you. And we got to interview you and talk to you a little bit, and we have you on film another time since then. Okay. So you've been quite a while, and you've been doing some home treatment, right?
Right.
You're not doing as much home treatment because you haven't needed as much, I understand. But you are doing that, okay. Pain anywhere? Are you feeling pretty good?
I feel fine.
Good, good. Well, let me ask you something, Mary. Can you stand up? Okay. Well, come on up. No, you just come on up. Okay. Let me see what you're doing about your walking now. Come on. Okay. Very good. Okay, just turn around and just go back. Now, you say that you're walking around your house, except for you got dirty spots on the walls where you touch them all the time?
Yes.
Okay.
Only I can't get to the living room without my chair.
Oh, you still have to have that for that, okay.
Yes.
Well, let me ask you something. You live in that body, we don't. What's your improvement since last October? How much have you improved?
I'm able to stand up usually,
Mm-hmm.
and I'm able now to wash dishes,
Mm-hmm.
and
Put your clothes on.
yeah.
You basically take care of your own self now.
Right.
Okay. And you walk around the house if you touch the walls?
Yes.
You just have to be able to touch a wall to walk around the house?
Yes.
Okay, that's good. And how about getting in the car? You get in the car by yourself now?
Oh, yes.
You get out of the car by yourself?
Yes.
I see you crossing them legs again. I know that first day you'd use your arms to do it, so that's good. You're feeling good?
Yes, excellent.
Okay. You're basically happy with what's happened so far?
Yes.
I know we still have a little bit of weakness in those ankles, though, don't we? And that's really your mobility problem now. And I know we put you on an exercise program that's going to help with that. Okay, so what we're going to do now is to do a little more work on them ankles today. In fact, we're going to work on everything today. We're going to concentrate on them ankles, okay? And we're going to review your home treatment program and possibly up.
Here is Mary leaving the office, walking with just a supporting arm from her daughter. She demonstrates her ability to walk unassisted by running her hands down the wall. 6 months earlier, Mary's husband passed away of a sudden heart attack, and she is now living on her own. She can even walk down the ramp just using the handrail. Although her diagnosis of ALS was confirmed by 3 medical doctors, Mary called us a few months ago to tell us they have now decided she could not have ALS, as she was improving and that was impossible. They had not expected her to survive through 1999. It was now 2002. She was laughing about it. She can now get in and out of car unaided and travels often to visit with her children. At last contact, she was still improving, and she told us the entire congregation of her church stood and cheered as she walked down the aisle on her own.